Hello, CreakyJoints. My name is Dr. Alfredo Rabinez. I am currently a physician at St. Barnabas Hospital in the Bronx. I am an emergency medicine physician. We currently see about 4 patients an hour per physician, and I have been working at this institution for now about 4 years. When I was younger, I had been involved in a lot of the care of my grandmother. So my sister, my cousins and I, we would really take turns in helping to translate the medical information provided to our family so that she can receive the best care. This sparked an interest for me, and I ended up volunteering at the hospital in the area. I realized that there was a need for physicians who spoke Spanish. I enjoyed the sciences, I enjoyed the maths, both of which I was told required or necessary for a medical degree. I went into it pretty strong. Newark has an immense amount of energy. The intensity of the city provides a very fast-paced environment for me to really make myself successful in some of the goals that I would like to achieve. As an emergency medicine physician, you are, in a sense, also a very intense person, seeing a lot of different cases at one time. New York assimilates to that. I'd like my environment to be very motivating and provide that sort of energy. It's also very diverse. It is very important to me. I look for institutions that have a Spanish-speaking community. I enjoy reaching out to that community and providing medical knowledge. When I'm in the emergency room and patients come in who only speak Spanish, I feel like I'm providing the service at that point that I was meant to provide. It makes me feel needed in that community. It makes me feel like as though I'm really touching those people in a way that they probably haven't had in a long time because they're always accustomed to someone not speaking Spanish. It reminds me of my grandmother, and I think that it was what I was meant to do. I would like to see personally a strive to help people with have anxiety or depression. Anxiety and depression become a very debilitating disease for many. You may know someone in your family, you may know some of your friends where it's impaired them so much that they can't really do much in their daily lives. I have patients that come in all the time with these symptoms. Sometimes they just use the ER as a way out, as a way to kind of free themselves from that anxiety. It is something that people should not be afraid of, should not be ashamed of, and we need to tackle that. I believe that they need to focus on their chronic disease as part of who they are, but not all they are. They need to focus on their health as part of a daily living. So if they're coping with a chronic disease, they need to be aware of what that disease really is and what it means and what it can lead to, complications, and situations where if they didn't take the medication or if they don't have medication, what happens if you don't comply with those forms of treatment. If you're focusing on a chronic disease, you need to make sure that you listen to your physician, understand that they're there to help you.